Good day, and welcome to another engaging discussion in our seminar series. Today's presenters discuss AI, environmental exposure, and health equity in African cities. Our lead presenter today is Abigail Oppong. She is a researcher with expertise spanning natural language processing, NLP, artificial intelligence, and digital health. Her career has combined technical innovation with a strong focus on advancing equity in health and technology. She has worked on projects exploring the ethical dimensions of data acquisition and attribution for low resource languages, and co-leads initiatives on decolonizing AI and community-centered AI development, particularly in the Global South, particularly for communities in the Global South. Notable among her collaborative works is supporting NGOs in rural Africa, where she designs NLP-driven pipelines to enhance maternal, child, and community health education, while exploring how edge AI can be leveraged to deliver timely and context-aware solutions in low-resource settings. Abigail is currently researching how African languages can be integrated into neurotechnology innovations, ensuring inclusivity in emerging brain-computer interface systems. Across all these projects, her work is focused on connecting directly to human security and population well-being by addressing structural inequities in data and technology, while advancing ethical, culturally relevant, and accessible AI solutions that strengthen public health systems and empower marginalized communities. Abigail is an active member of our cluster on transformational education, AI, and emerging technologies. With her this morning is Dr. Mable Kipenda. Dr. Kipenda is the founder and CEO of Kambo Health Initiative, which is based in Lusaka, Zambia. And she's also the director of health programs and clinical research within the Urban Health 360 family. She's a medical doctor and a public health specialist with over 7 years of experience advancing health systems and policies in Zambia and the sub-Saharan Africa region. As the founder of Kambo Health Initiative, she plays a pivotal role in strengthening sexual and reproductive health understanding, awareness, and services for adolescents, women, and underserved populations. Her work has spanned clinical care, national health strategies, advocacy, and research, including the Zambian National Adolescent Health Strategic Plan and the National Reproductive Health Policy in collaboration with the Ministry of Health. As a national and technical advisor, she led the implementation of high-impact, evidence-based health interventions and led research efforts on adolescent health, gender transformative health approaches, and maternal health. She's a co-investigator on national studies and has made these, shared her knowledge at numerous global conferences, particularly things like ICASA and the Medical Women's International Conference. Notably, Dr. Kipenda is also a Mandela Washington Fellow and a Chevening Scholar, which recognized her for her leadership in public health innovation. And her expertise and passion is focused on driving sustainable reforms, and she continues to shape systems that prioritize equity, accessibility, and youth empowerment, very important in the global majority. With us discussing all of this, the work of Abigail and Mable, is Dr. Kutisha Ebron. Kutisha is a scholar practitioner and thought leader in ethical leadership, social inclusion, and gender justice. And she has over 15 years of experience within the United Nations system. She served on the Secretariat for the United Nations Secretary General's High-Level Panel on Women's Economic Empowerment and is a co-researcher and co-author of the landmark global policy paper, Women Belonging to Communities Discriminated Against on Work and Descent, Advancing Intersectional Rights and Justice. And that was launched at the UN High-Level Political Forum in July 2025 to mark a historic milestone in United Nations Women's first global policy paper addressing the rights of communities affected by descent-based discrimination. All right, so you can see her expertise is global. Her portfolio spans high impact programming across ending violence against women, gender equality, women, peace and security, and social and racial integration. And her scholarship further interrogates the intersections of socioeconomic justice, equity and inclusion, health disparities, and gender based violence to advance data-driven and intersectional approaches to systemic and structural change. In addition to this, Dr. Ebron has held academic appointments as adjunct and affiliate faculty at William Woods University and St. Thomas University, and currently serves as adjunct faculty at Southern New Hampshire University, where she teaches on leadership at the graduate and doctoral levels. During the COVID pandemic, she was stationed in Cairo, Egypt, and contributed to the COVID-19 task force by supporting gender responsive crisis response initiatives at the intersection of public health and gender equity. She serves on the editorial boards of Community Dynamics, an international and interdisciplinary journal, and the International Journal of Public Leadership, and co-chairs the Intersectionality Special Interest Group for the Global Law Enforcement and Public Health Association, GLIPA. In addition to her UN experience, Dr. Ebron has held research fellows appointments with Women's Economic Imperative and currently with Urban Health 360, where she continues to serve as a subject matter expert. Her work speaks for itself, and her scholarship is really emergent and really impacting the focus on equity. So it's wonderful to have her as a discussant on this very important work that is led by Abigail Oppong and supported by Mable Kipenda from the lens of maternal and child health, adolescent youth, etc., all focused on how do we engage the global majority, particularly countries and communities on the continent of Africa, in this whole discussion around use of AI, environmental exposure, and health equity. And with that, I present our distinguished panel and ask Abigail to begin the presentation. Thank you. Over to you guys. Let's have fun with this.
All right. Okay, thank you, Dr. Yonette, for the introduction, and thank you for the opportunity today. So today, my presentation, I'll be presenting together with Dr. Mable and myself, and our topic is breakdown or breakthrough AI, environmental exposure, and health equity in African cities. So during the course of our presentation, these are some of the key questions that we'll be analyzing and also asking ourselves as well. The first question is, how can AI be used to better understand and address environmental health risks in African cities, where exposure, vulnerability, and access to support are often unequally distributed? And also, are current AI systems helping African cities make better decisions, or are they reproducing forms of invisibility by failing to capture the realities of underrepresented urban populations? And lastly, we're also looking at how AI might support more context-sensitive responses to maternal and child health risks, and also respiratory illness, nutrition, water-related diseases, heat stress, and the likes. So the key point that we are looking at here is probably on how in many African cities there are this kind of fragmented data, more of, we don't have like a data problem, but then we have more of a representation problem as well. And day in, day out, environment is shaping our health and are deeply known by the communities, but then they are often, I would say, poorly captured by the systems meant to help inform and then make decisions as well. So today, the big question that you're asking, I mean, from my previous key questions are also, is AI helping us see better or making some realities disappear as well? And also another key point that we are looking at is looking at how AI as a tool can be used as a translation, coordination, and community-grounded insight to help make these decisions as well. All right, so globally, there's been an opportunity of how people are using AI and also integrating it into environmental health, in the case whereby they are using AI to measure the kind of exposure that a community may possess in order to help inform, make decisions. So in reality, this is something that is, going on. Conversations are ongoing to see how best AI can be integrated into helping to solve these environmental issues as well. And I came across this platform called Climate Trace that has the environmental exposures from across the world. Yes. And from the pop-up, you could see that they have like some specific exposures that they kind of measure. And so in this kind of global platform, we are asking whether existing global tools actually cover the traditional and informal environmental exposures in Africa as well. So as you can see, this is like a demonstration of the air quality in Accra, which looks great as well. But then from the data that is here, we could only see carbon dioxide, CH4, H2O, and all that. But then probably from our end, we are kind of also projecting and also asking the question whether these are only the environmental exposures in probably Accra, Ghana, or there are more that is not being captured by this global platform. Yeah, so as I mentioned earlier, the global perspective is something that's ongoing. The conversations are ongoing where we are trying to see the synergy of environmental exposure data, health, and urban cities as well. And so through this presentation, I'll also be talking about some of the works that I've done, probably with data that is not from Africa. And that's why it's kind of inspired this work as well. But then this is to showcase how AI can be integrated into such environmental health data in Africa as well. And so this picture at the left, we have a child. We have like two child, one white child and one black child, of course, from Africa as well. And currently in the literature and also with projects that are ongoing around the world, you could see that researchers are really looking into how children are exposed to multiple environmental chemicals and all that. And so in this project, I was kind of attempting to analyze the data available. I think there is an availability of a Helix project data as well. And in this project, the question that I seek to ask was, how do prenatal and childhood environmental chemical mixtures jointly influence child BMI Z-score, and which components of the mixture contribute most strongly to this association? And on the right-hand side is an image that I saw from LinkedIn from one of a climate activist from Ghana, Ifejapma, and she made a comment that this baby that you see on the screen just arrived, and the world greeted her with heat and sweat rushed on skin that has never known heat. A body too new to cope with this kind of situation. And so today the conversation here is not to, compare the two, but then to actually take these words into action and see how best as African we can learn from whatever is going on around the world and also set ourselves ready to be able to, gather this data and then make good use of this data as well. All right, so going back to the project that I mentioned, which is the availability of the helix data. This was a data that was collected from 6 European countries: France, Greece, Lithuania, Norway, Spain, and then the United Kingdom. And it was data that was collected from a mother-child pair during pregnancy as well. And some of the health outcomes that they were looking at was child BMI, asthma and allergies, and neurodevelopmental developmental issues as well. Some of the domains when it comes to exposure, the environmental exposure that they were looking at was also the chemicals in the environment, air pollution and urban environments, lifestyle, and some of the social factors. And of course, indoor and outdoor exposures as well. And during this project, I narrowed down a bit and did a sampling of, since I'm focusing on child BMI, how environmental exposure affects child BMI. I narrowed it down to study like 800 children as well, and probably from a population of 1,301 children, that's like between 6 to 11 years as well. And some of the other factors that were kind of visible in the data were also like maternal BMI, the child sex, and maternal education as well, and the cohorts as well. Some of the exposures that were kind of visible as well were ACB, DDE, and the likes. And these are all kind of environmental exposures that probably exist in these European countries as well. Yeah, so these are some of the results that I get to kind of visualize after using some machine learning methods and all that. But then I will not go much into the technicalities, but then I just wanted to highlight how AI can be used to actually separate the environmental exposures, because when I look at the data, it's like a really kind of complex data. And so at this point, we are trying to use this machine learning methods to understand which exposure contributes more to child BMI and the likes as well. And then for the first image, you could see that from this part, the higher part, you can see that there are some elements that are setting apart. And so it kind of shows us that, oh, okay, these are some of the exposures that are connected to child BMI. And at the left bottom as well, you could see how some, elements are also separating themselves from the many. So this means that at the end of the day, these are some of the exposures that are connected to the child BMI. That's the topic that I wanted to look at as well. Yes, and I think this is, something very, very, very impactful, because at least it's informed researchers and everybody engaged to know exactly what kind of exposure is connected to child BMI after collecting, the data and all that. And at the right-hand side are the names of the chemicals and also the covariants to kind of understand which one is actually, contributing to this kind of issue, which environmental exposure is actually contributing to this kind of issue. Yeah, these are like a whole lot of long chemicals names. So I'll just leave it here, and then but then I just wanted to show that there's an opportunity that AI has to actually help us understand which kind of exposure affects children when we have a more complex data that we want to understand as well. Yes, and similar as this, probably here I was trying to narrow down and then focus more on the exposures that were kind of separating themselves to really understand to the extent of the intensity of how they actually affect the children and all that. Yeah, so these are all like some machine learning methods and traditional statistical methods that can be used to actually understand from the data that was collected from these 6 European countries and help inform mothers, clinicians, and all the stakeholders involved about which chemicals they should be aware of. And this is something that could be used to inform policies and also educate the public at large as well. Yeah, so I mean, at the end of the day, through this I would say little analysis, we're able to show that early life environmental chemical exposure acts jointly to influence child BMI, even when individual exposure appear weak on their own. So at this point, we also show that exposure itself will not be like maybe the main exposure affecting child BMI. It could be like a cluster of 2 or more exposures as well. And these AI tools help us identify this to be able to, educate mothers and also probably help these babies that, come out from their mother's womb to the world as well. All right. Yeah. So along the line, I think I've made a whole explanation and also some of the opportunities that AI can actually help us when it comes to environmental exposures and how it can also help us make some informed decisions. So back to some of our key points on whether current AI systems, probably our current AI system helping African cities make better decisions, or are they reproducing forms of invisibility by failing to capture the realities of the underrepresented urban population? And I mean, this is something that Europe has done, collected data, analyzed, informing stakeholders across the health, social, humanities, policies to make informed decisions. But then from the African, perspective, is it something that we are thinking about along the way to make sure that our data are more useful as well? So these are some of the environmental health risks that we kind of identified or we want to highlight. Air pollution is one, soil pollution, water pollution, waste management is also like a very big issue as well, and occupational health hazards, food and vector-borne hazards as well. For the context of Ghana, I think because something Galamsey, that's like the illegal mining, and it's been like an issue in Ghana for a very long time, and I see it as an issue that is more of health-wise, political, economical. It's just like affecting the whole kind of domains as well. It's not only maybe about politics, because normally the politicians are the ones to say nobody should mine, but then sometimes they don't as well. And this helps us to start to think about how politics also, affect health as well. But then in Ghana, this issue is very rampant and then is ongoing. that you could see, like many of the waterfalls and rivers in Ghana have turned into this, like you see in the picture. And one of the sad moments is that normally you see the children, you know, on the Galamsey side, trying to also mine and all that. And there are also some very powerful chemicals that, you know, these miners use in doing these illegal activities. And sometimes I've been asking myself, like, how does it even affect the children? Is it something that the children are supposed to get closer as well? And even while thinking about those closer to the site, we're also thinking about how these water from the site also run into the water that we use in our various homes and all that. And so there's been some research from researchers from Ghana as well, talking about how this kind of causes kidney issues and all that. Because this year, when the reports come up for like Ghana on kidney issues, it was really high, and we were all wondering why this was so. And so the doctors raised an alarm that this is also an issue as well. And of course, in Zambia as well, probably the same issue on how illegal mining is also affecting water pollution as well, and also the problem of droughts and hydropower energy, which is also another issue in Ghana as well. And for South Africa as well, I think this paper is from Dr. Mercy, where she was looking at health risk assessments of informal food vendors, doing a comparative study in Johannesburg, South Africa, trying to understand some of the exposures that affect these informal food vendors, both for those that are indoors and also outdoors, which, I mean, shows some of the works that is already, you know, going on, or some of the topics around environmental health in Africa as well. So I'm sure this context from Ghana, Zambia, and South Africa also helps, gives you an overview that there are actually some, you know, causes of environmental health that are, you know, specific to these countries and also communities that need to be captured, that needs to be, you know, put down in a form of like data when we want to, you know, start thinking about AI applications as well. All right, so I'll leave it to Dr. Mable to take it over from here.
Thank you so much, Abigail, and very insightful discussions. As you can see, Abigail did really speak a lot about how we have environmental exposures and also how AI has been used in some of the examples that she's shared in really addressing health needs for a human population. So our next key question is how AI might support more context-sensitive responses to child and maternal health risks, respiratory illnesses, nutrition, water-related disease, heat stress, and other conditions shaped by everyday urban environments in Africa. So we just want to see whether how we may integrate AI into some of these conditions, health conditions that we are seeing across Africa that are directly contributed to by the health, by the environment that we are in. So first we need to understand the impact of the environment and particularly climate change on the human population. So when you see in the first diagram, I know that it's not very clear, but if you zoom it in, you'll be able to see, we'll be able to see some insights there. But ideally, it's just showing us how each and every environmental exposure is directly impacting the health system. The health, the body, the human body. For example, you can see how air pollution here is directly impacting the cardiovascular system, and you can, as well as the respiratory system, where you can see the asthmas, you can also see cardiovascular diseases that are coming as a result of air pollution. The same with water quality impacts. You can see that these directly impacts the human health because of the toxic algal blooms. You see cholera and other waterborne diseases that emanate from water quality impacts. Extreme heat is something that we're always discussing because this is something that has been very significant in the past years, especially in sub-Saharan Africa. So we can see that extreme heat directly does affect the health of a human being. You see heat-related illnesses and death, and even just sudden deaths that are happening could be related to extreme heats that we're currently experiencing. And then on the right side, this is just the socio-ecological model that's also trying to describe what the impact is of the climate change and the environment in general on human livelihood. How is it directly affecting the socio-economic status of humans? So you can see that at the blue circle there, it's really impacting on level, and you can see that there would be like climate-induced conflicts. There's a lot of displacements, involuntary displacements. There's disruption in farm activity. And then the second level, which is the sectoral impacts, we can see that there's a lot of breakdown in agricultural production. There's a lot of food insecurities, such as in droughts. You see that challenges come with scarcity of food because of the droughts that were there. Also, water scarcity is one of the issues that come when there's drought and extreme heat. The next level is the impacts on fiscal and monetary policies. This is the financial space, and you can clearly see that there's some upward pressure on food and transport inflation due to extreme weather events and eroded foreign reserves, which weighs on the exchange rate. So you see the fluctuations of exchange rates in countries that have been impacted by change in the environment or just directly climate change impacts. The last level is the aggregate impact on economic welfare. So you can see that there is loss and damage of costs due to climate change. There is also a lower GDP that we might experience because of the changes in the climate atmosphere. So what are some of the key strategies that we can employ in order for us to definitely leverage AI in terms of addressing the health burden that comes as a result of environmental exposure? So when AI is driven in fusion combined with clinical and environmental infrastructure and satellite inputs, it's really used to reveal hyperlocal health risks that national surveys miss. And also this enables geographically precise targeting of interventions and resource allocation. And then you see that implementation requires like an interoperable data pipelines and alignment with local planning cycles. So when when you combine different sectors, different areas using AI, you see that you get a better impact and you get better outcomes on how to address some of these health issues that we've just discussed. And then machine learning models, as we've clearly seen during when Abigail was sharing, do capture complex and non-linear determinants of maternal and child health. And also they improve risk stratifications beyond simple rules. But the only challenge is that most models remain experimental and they are rarely integrated into routine care pathways. And this is something that we've actually seen here across Africa. We've done a lot of experiments with AI, but we've not directly started using AI in practice so that we see whether these models or this innovation is actually yielding a positive outcomes in terms of addressing the health needs of the human population. So this is just an example of one of the key strategies that have been used to integrate AI into addressing health problems that emanate from climate and environmental exposures. So the water-related disease and cholera. So in parts of Africa, I think this was like in Nigeria, machine learning has been applied to predict and monitor cholera outbreaks. in sub-Saharan Africa, and these models have been integrated into socioeconomic and environmental factors to identify high priority interventions. So you see that the data inputs here, what they inputted in the AI machine learning model were rainfall patterns. So they captured all the rainfall patterns over a period, since sanitization infrastructure. So they looked around in that area, they looked around and captured as much data as possible around the sanitation, and also the population density. And what they did, they got this data and they inputted it into an AI machine learning model. And then the outputs that came out were that they were able to have 8 weekly alerts. So this was like to predict the weather patterns so that they're able to better respond to any health risks that may come from that climate issue. Also, hotspotting mapping, they were able to see where some of these health issues were actually coming out more, and where there were more, there were much significant discrepancies when it comes to weather patterns. Then the other one also, they were able to deploy resources. So they were able to bring in a number of resources that help address any issue that is expected. So in short, they were just able to have like a prediction model that helps them really better address the health risks that might come from a weather pattern change or just climate change in general. Another example is the maternal and child health, and there was a study that was done, and it was reported in the CAMI study, and that was around AI adoption. And what the study said was that the leading applications that are currently being used across sub-Saharan Africa is telemedicine, which really spans out as the highest. And for real, we see telemedicine has really been integrated into health. We see there's now a lot of online consultations. There's applications where you can just log in and see a doctor, and these are examples that are cutting across the entire sub-Saharan Africa. I think we have 2 models of telemedicine here in Zambia. I know in South Africa there's also one, and just some months ago we were interacting with a colleague in Namibia who's actually leading a telemedicine company. But what also spans out is also the section maternal and child health, where they're saying 20% of some of these leading applications have sexual maternal health, and most of it is around risks assessment, as well as monitoring purposes for the mother as well as the child. And then when it comes to sexual risks, also there's been some models that have been employed where you are able to determine risks using social demographics as well as socioeconomic data in particular regions of the country. The other part is healthcare operations. This has been around, but I think the key ones are really telemedicine and SRH, which is the main focus for this discussion. Medical imaging is also there, and also this one has been around for a very long time. So what opportunities do we have in terms of integrating AI into integrating AI so that we are better equipped to address the health issues that come from environmental exposure? So one key component that we've actually seen, and a lot of communities and a lot of regions are actually exploring, is working with community health workers. And this is a very high leverage entry point, because we do understand that the community health workers are most likely the first point of contact for the community. So they go in the community to help the community members address their health needs. So these are great cadres to work with when trying to integrate AI, because they would be able to capture as much data as possible within the communities that they visit. And more so, they are also interacting with community members that are more at risk, but they're not yet into the disease burden. So they're not yet at the hospital, but they are at risk. So these are key workers that would really give us opportunities in terms of integrating AI into the health model, aligning it with environmental exposure. The other one is computerized clinical decision support has worked. I think we've seen a lot of, for example, we call them POCs. I think it's point of contact devices that now clinicians use at bedside. So previously would have to send a patient to the laboratory or a patient to the imaging, but now there are these small devices that clinicians are using at the bedside to better understand or better make an informed diagnosis. So they will have that device and it will help them. For example, an ultrasound for obstetrics. So in case they just want to see how the baby is doing, instead of writing an imaging request and asking the pregnant woman to go to the imaging room, they would perform that ultrasound at bedside and it would help them make a decision on what to do next. And that actually improves the diagnosis time, as well as it better gives the clinicians options on how to treat that patient. And just to close off, and this is, I think, our last slide, we just have this call to action. And our conversation really is that if we really have a goal in terms of integrating AI, environmental exposures, as well as the health burden that comes with these environmental exposures, is to create AI by communities. And by communities, we mean working with the communities themselves, because they better understand the environmental patterns than anyone else in their community, than anyone else in the team. So they would tell you the patterns, they will tell you what they do. And so that information is very important to teach these learning models. So the communities 100% need to be a part of these AI integrations, especially when we are building the data sets, like I said, the tools, the feedback loops that reflects the realities of communities like Kanyama, which is here in Lusaka, Anima, Kaelischa communities, rather than just those of academic health centers. So the idea is to really focus on building AI systems or AI tools that have been informed largely by the communities. And yeah, so this is what we had. And thank you so much. And I'll hand it over back to Dr. Thomas.
Thank you, Abigail and Mable. This is the reason we have a panel like this. It's truly interdisciplinary, because here we bring together a computer scientist who's focused on AI and machine learning, and who's figuring out, how do I use my tools to better communities in Africa. We bring her, Abigail, with you, a public health physician, who is focused, who's actually treating patients, working in underserved areas, and thinking of, how do I better the experience? How do I lose less people in underserved communities within the context? Yes, those things that you described are available, but in the capital cities, how do I reach people in the secondary and tertiary cities that I deal with, that I treat on a daily basis? And with a social scientist in Kutisha, who is focused on equity and empowerment. And one of the nice things about this panel is that we have a conversation and try to interrogate ways in which new technologies and data and information gathering can be informed by physical and social and environmental contexts. and community knowledge and awareness, which is so critical. And it's important. I hear all the time from Abigail, our computer scientist in residence, that we need to recognize that algorithms are often based on the lived experiences of people, and we need to involve more thinking of people like yourselves in what's the evidence that's informing those algorithms, because they have to reflect the lived experience of people. So one of the questions before we go to Kutisha's perspective, Mable, I want you to think of, when we come back for discussion, specific ways in which AI and machine learning could help you in your work in hard to reach areas in Zambia. Yes, those things at the bedside are involved in the capital cities, but I've heard from you that oftentimes you're dealing with a local village health center, and all you have to help you in the birthing of a child or a difficult birth is a community health worker, and you're in there needing other resources. So think about that when we come to the discussion. And Abigail, if you could be thinking of what specific data can better inform your machine learning applications and integration for underserved African communities. So as we think about that after Kutisha's taking us on the rights and equity issues and leadership empowerment issues that we need to focus on. So over to you, Kutisha.
Okay. Thank you, Dr. Thomas. Thank you for the opportunity to be here, to contribute to this critically important conversation. And also thank you, Dr. Mable and Abigail, for this thought-provoking purview of the current status of AI in Africa. And I want to begin with a provocation. When we gather to discuss artificial intelligence, environmental health, and health equity in African cities, there's a powerful persistence temptation to frame what we're doing as a technical exercise. A conversation about data pipelines, algorithmic models, satellite imagery, and predictive surveillance systems. And while these tools matter enormously, I want to suggest to you today that if we begin and end with technology, that we have missed the most important part of this conversation entirely, because the environmental health crisis confronting African cities because of mining-driven water contamination, drought-induced energy insecurity, fragmented health surveillance systems, and the compounding vulnerabilities of communities bearing the greatest burden of global resource extraction are not at their core technical failures. They are the leadership failures. They're the failures of vision, failures of accountability, failures of political will, and failures of the moral imagination necessary to govern the interests of the most harmed rather than the most powerful. This is why the leadership ideology is not peripheral to this discussion. It is foundational to it. The intersection of artificial intelligence, environmental health, and health equity in African cities does not present a technical problem awaiting at a technical solution. It presents fundamentally an adaptive challenge, one that demands a caliber of leadership capable of interrogating not only what AI can do, but whose interests it serves, whose realities it reflects, and whose invisibility it risks perpetuating. Viewed through the convergent lenses of transformational leadership theory and adaptive leadership theory and epistemic justice, this discussion surfaces critical imperatives that extend well beyond data, architect, and algorithmic design into domain of knowledge, power, community agency, environmental governance, energy justice, and the geopolitics, of global resource extraction. The world has turned its focus towards Africa, and it has done so with intention, urgency, and considerable economic interest. Over the next decade, multilateral organizations, including the United Nations, large international non-governmental organizations, and an expanding constellation of private sector actors are repositioning their operational centers to Nairobi, Kenya, and to other key regional hubs across the continent. This political reorientation is not incidental. Africa holds an estimated 30% of the world's mineral reserves, including cobalt, coltan, lithium, and rare earth elements, which are indispensable to the global technology economy. The batteries, semiconductors, and data infrastructure upon which artificial intelligence systems, cloud computing platforms, and digital economies depend on. In a very literal sense, Africa's subterranean resources are keeping the world's technologies alive. Yet, this moment of continental centrality demands a searing leadership question. Who bears the environmental and health costs to this global dependency? And who controls the terms of engagement? The establishment of AI data centers across African cities, energy intensive facilities that consume vast quantities of electricity, water for cooling, introduces a new consequential layer of environmental pressure into communities already navigating the compounding burdens of mining-driven water contamination, drought-induced energy insecurity, and fragmented health systems. Transformational leadership theory compels us to ask not merely whether these investments generate economic growth, but whether they advance or undermine the health equity and environmental justice of the communities in those that they operate. Adaptive leadership demands that we surface and confront the value conflicts embedded in this question between national economic development imperatives and community level environmental protection, between global technological progress and the local health equity, rather than suppressing them in the interest of institutional consensus. The movement of multilateral organizations and the private sector to Nairobi and other African regional centers creates both an imperative and an opportunity. It is an imperative because the concentration of institutional power in these urban hubs will intensify existing environmental pressures. It will accelerate resource extraction and deepen the structural vulnerabilities of peri-urban and rural communities located along the extractive supply chains. It is an opportunity because proximity creates accountability, and transformational leaders within the institutions must be challenged to translate their organizational commitments to sustainability, equity, community partnerships from policy language into binding operational practice. Next, who will pay for the damage? Accountability, reparative justice, and leadership responsibility. The question of who will pay for the environmental and health damage generated by the extractive industries, AI infrastructure development, and the intensification of resource exploitation across Africa is not merely a financial question. It is a leadership question, one that goes into the heart of what transformational and adaptive leadership demand in conditions of structural inequity. Historically, communities that have borne the greatest environmental and health burdens of global resource extraction have received the least compensation, the least regulatory protection, and the least meaningful participation in the governance decisions that shape our exposure. This pattern constitutes what Fricker identifies as a compounded epistemic injustice. Communities are harmed not only by the physical consequences of the environmental degradation, but by their systematic exclusion from the knowledge systems, legal frameworks, and institutional processes through which accountability is established and redress is pursued. Transformational leaders within multilateral organizations, national governments, private sector entities, and civil society must advocate unequivocally for polluter pays frameworks that hold extractive industries and technology corporations accountable for the full environmental and health costs for their operations, including long-term cumulative cost of water contamination, soil degradation, and eco-destruction. This requires legislative courage, institutional independence, and the willingness to confront concentrated economic interests that have historically shaped regulatory environments in their own favor. Bass constructs of ideal influence, the degree to which transformational leadership models, the ethical standards they expose, is directly implicated here. Leaders who advocate for environmental accountability must themselves embody transparency, integrity, and community orientation that genuinely make others accountable. Adaptive leadership further demands that we resist framing accountability as purely technical or legal challenge. The deeper adaptive work lies in shifting the values and assumptions that have historically rendered African communities' environmental losses invisible to the global institutions and markets that benefit from the resources extracted from their land. This is a generational task, one that requires sustained values-driven leadership, committed to redefining the terms of global economic engagement with Africa, not merely unpleasant, its worst consequences. The urgent leadership challenge lies a foundational question of resource governance. Who has access to Africa's resources, and who has the power to protect the communities from which those resources are drawn? This question implicates the full architecture of global economic governance, international trade agreements, bilateral investment treaties, national mining legislation, and the institutional frameworks of multilateral organization. And it demands transformational leaders with both the vision and the institutional courage to challenge the arrangements that have historically privileged the interest in external actors over those of the African communities. The concentration of rare earth minerals, water resources, arable land, and now digital infrastructure investment in African territories creates conditions of what scholars of extractive political economy describe as curse dynamic, which in the communities most proximate to the valuable resources experience the greatest environmental degradation. Excuse me. The least economic benefit and the most acute health inequities. AI data centers in this context are not categorically different from mining operations, but are resource intensive enterprises that draw on Africa's environmental endowment, minerals, land, water, energy, to generate value that flows disproportionately outward, while the environmental and health costs remain local, concentrated, and disproportionately borne by the most marginalized. Transformational leadership theory calls on leaders to envision and build systems of fundamentally different from those they inherit to articulate a normative vision of resource governance in which African communities are not merely the site of extraction, but the primary beneficiaries of the value of their resource that their resources generate. The vision must encompass enforceable. I'm sorry. The the normative vision of resource governance in which African communities are not merely the site of extraction, but the primary beneficiaries of their resources generate. The vision of this must encompass enforceable community benefit arrangements, meaningful free, prior, and informed consent processes, equitable revenue sharing mechanisms, and the institutional frameworks necessary to ensure that AI and technology investments contribute to. Rather than compound environmental health equity, adaptive leaders must mobilize the coalitions necessary to translate this vision into governance reality, holding space for political resistance, institutional inertia, and competing interests such as transformation will inevitably encounter. From an epistemic standpoint, Fricker reminds us that most powerful acts of leadership in this context may be the simplest and most radical to listen, genuinely, structurally, and with binding consequence to what African communities say about their own resources, their own environments, and their own health. To recognize community members not merely as stakeholders to be consulted, but as knowers whose testimonies carry authoritative weight in the governance decisions that shape their lives. To build AI systems, health monitoring platforms, and environmental governance frameworks that epistemically accountable to the communities they affect, not merely technical, responsive to the institutionals that fund them. When we talk about the mining water pollution, the most consequential and under-examined environmental health crisis facing African urban and peri-urban communities is the contamination of water systems through both legal and illegal operations, something that Dr. Mable and Abigail discussed. It represents one of the most acute manifestations of this crisis, introducing heavy metals, including mercury and arsenic, into river systems, groundwater reserves, soil ecosystems upon which communities depend for drinking water, agricultural production, and aquatic livelihoods. The health consequences are severe and disproportionately borne by the most marginalized: kidney disease, neurological damage, reproductive and fertility complications, and elevated risk of childhood development harm. Yet, legal scale mining operations sanctioned by the national regulatory frameworks and international investment agreements generate comparable water contamination loads while being systematically afforded greater institutional legitimacy, regulatory protection, and epistemic authority than communities they can displace and contaminate. The concept of testimonial injustice is directly operative here. The experiential knowledge of communities living downstream from mining operations, their testimony about water discoloration, crop failures, illness, and ecological degradation is routinely discounted relative to the credentialed assessment of corporate environmental impact studies and state regulatory bodies. Transformational leaders must challenge this epistemic hierarchy directly. There are 5 recommendations that I feel that we should address and consider as we move forward. So the first is establish community-centered AI governance frameworks. Second, enforce comprehensive polluter pays accountability for legal and illegal mining operations. 3, develop integrated climate resilience, energy, and water security strategies. 4, mandate equitable resource benefit sharing and community protection agreements. And 5, cultivate a new generational, transformational, and adaptive leaders committed to environmental health justice. Thank you.
Thank you so much, Kutisha, for those extensive comments and very appropriate for the discussion. I think your comments highlight the need for engaged, and I stress the word engaged, multidisciplinary efforts at the municipal and the community level. It's no longer a national imperative. And because what ends up happening is gets caught in the political economy of it all. And we need to think of at the municipal and community level what difference can be made. So it's a bi-directional movement, because yes, those things, many of the things you mentioned, should be part of the national framework. But what always often happens, as we see with the Sustainable Development Goals, we talk about them nationally, but the communities that need to implement and affect them are not engaged. They have no concept of what the SDGs are. So naturally, and we're talking about the African context now, or naturally, those things fail. We don't make the benchmarks because we're not engaging communities and municipalities. That's why cities and city governance and municipal government and county governance plays a role in this, and communities are engaged in that. So it has to come from two levels: national, yes, but it has to come up from community and municipal approaches. So my question to you, as we round this discussion, how do we as researchers and thought leaders build the multidisciplinary teams, given what you're mentioning, that directly engage and inform at the municipal and community level. So think about that as we meander through this discussion. We're at the 30-minute mark, and I'd like to bring us into a discussion further. And I see that Karthika is here and Janata. And if you have questions, please indicate them. I'm going to, at some point, bring you on the stage so that you can be part of the discussion. But I want to come back. So I'll give you a chance to think about that question, Kutisha. And I want to come back to you and Mable. Mable and Abigail, with my earlier question. So some thoughts on that. And if you need me to repeat the questions, I'm happy to do that for each of you. Go ahead. You need to unmute yourself. Yes.
Thank you. Thank you so much. And thank you so much, Kutisha, for those insightful words. I think it really does echo around how we are investing and how we are actually narrating leadership when it comes to environmental exposures, as well as the integration of AI in particular when it comes to health systems. So back to your question, Dr. Thomas, there's two things that I would really propose, looking at it from a very practical example. So we could integrate AI in the rural setting. I know that we are big on urban settings, as we have a couple of advancements that help us address the health needs. But when it comes to rural areas, there's two parts. So I would clearly, categorically say that it's important that we integrate AI into the health system's perspective, and particularly in terms of resource. So we know that our health systems are very fragmented, and we know very well that we have inadequate healthcare providers. It's even worse in rural settings. So you find that the smallest unit of a health center has only one qualified health personnel, and that's maybe a nurse. And then everybody else there are just support staff. And so 100% of the time, that health personnel is overwhelmed with lots of work. They are doing both administrative work, they are doing clinical work, they are trying to make sure that the healthcare center is functioning appropriately. And so that really puts a burden on the quality of health that the community members get to receive. So I would recommend, or I would see AI working very well in advancing some of these tasks that this health personnel is doing, which an AI could do. For example, health records, if they need to input, because we have this health management information system that is captured by a paper aggregate, and then that's then captured into the computer. So if some of those tasks are delegated to AI, for example, then that particular healthcare provider will then concentrate much more on helping the communities that come for for their health needs, or they come with their health issues. So I see that as a very interesting approach of integrating AI. That way we are offloading some of the unnecessary or some of the overload that one personnel has, which may not even be part of their job description. Just because they don't have anybody else to help them, they find themselves doing other small tasks, which then culminate into work overload. So that's the part on the health system. Then going back to the community, I think it's very clear that by now we have understood that community members understand trends, they understand environmental trends, for example, they understand their community better than anybody else. So I would see AI work very well in being an aider or a predictor for some of the health issues that come from these exposures. I think that the community members are very much knowledgeable on the environmental exposures. They know that this year we might not have much rain because of the weather patterns that we've had, or this year might be very hot as compared to last year. So they do have this understanding, but I think what they lack is how do they then protect themselves from having health conditions? How do they better prepare themselves from getting sick based off those exposures that they've had? And then particularly for maternal and child health, and that's somewhere where I'm very passionate about, we've clearly seen that we are doing very well in helping mothers give birth safely. And we want to track and see those that have complications. We refer them to a higher, from a rural area, they refer them to a much higher quite early. But what we are missing are those that are okay. So those that are okay, we usually just treat them as business as usual, because we're not expecting them to get into a complication. They don't have high blood pressures. Everything looks okay. But the sad reality is if that mother or that pregnant woman that we have been clearly covering up, thinking they'll have a normal birth, then complicates, then that becomes a problem, because they are still in the rural area. There's distance to it. They cannot easily get to a health facility, and they are complicating in that moment. So those are the missed opportunities that we tend to see, or the actual maternal deaths that we tend to see, because we were so much comfortable in their state, not knowing that they would complicate in a minute or so. So AI would better work to prepare even those that are progressing well in their pregnancy journey, to better prepare them and alert them, so that if anything comes up, even before they complicate to a very worse, they should already have had some they should already have some alerts or some early warning signs to say, you know what, my BPs have been okay, but I think because of the sun, I'm dehydrated. Because of the extreme heat, I'm dehydrated. So maybe I should start heading to the facility now, because I've seen an alert on my phone, or I've inputted some symptoms that have given me an idea of where I might end up being if nothing is done. So I think that would also be a very great space to utilize AI. So I'll just pause here and then hand it over to Abigail.
Thank you for that, Dr. Mable. Abigail, so I raised the question on specific data. You got some more insights, specificity. What would you, as the computer scientist, need to develop a functioning system to respond in underserved communities?
Yeah, all right. Thank you for the question. And thank you, Dr. Kutisha, for the wonderful discussion as well. And so for me, I mean, when I'm asked that question, a lot of things come to mind. And the first thing that comes to mind that I normally see in the tech space is that normally as Africans, we tend to kind of create this kind of benchmark data sets that I am strongly against, because I feel like benchmark data sets is kind of copying someone's strategy of extracting or collecting data from their community, and probably using that same strategy to kind of also do same for your community. So for me, when it comes to specific data, I would say the first thing is supposed to be like a more representative data from the community as well. And probably I'm looking at all kinds of data technically. Right now you're talking about environmental exposure. So I'm looking more into the environmental exposures that are more contextual to Africa and not like maybe elsewhere, something that's represents the way that people live and all that. And also one thing that I wanted to mention is tied to high quality data, which is also tied to the communities, because when you want like a high quality data, of course, it's supposed to be from the communities and not like elsewhere as well. And in Africa, I think we have a problem with how we keep our data, how we store it and everything. And Dr. Kutisha mentioned something about transformational leadership, which I think is a very key point here of seeing it as not a financial question, but a leadership question. So for instance, right now, if you are presented with, maybe $1 million to work on a data project, the question is it going to be fruitful, or are we going to have like some leadership, problems at all? Yeah. So when it comes to the specific data, for me, I look across a whole different domains when it comes to communities, when it comes to economics, when it comes to politics, because we are citizens of the country, but then we are being governed by, a whole president and their ministers and all that who make laws to help with the community. But in a case whereby the leadership is kind of low, then you will see, our data all over the place. And probably then the question comes to when we have this kind of fragmented data as well. And so when it comes to, having a more governance resources to kind of shape the way this data is being produced and also governed, I think it's been mentioned during the discussion as well as to who owns the data as well. And for me, I would want to really, really work on the data that is from the community. I think that Mable has mentioned that a lot about, putting much more efforts on the community itself. And I'm always talking to her. She's always mentioning, we need to be very specific on the kind of community. And I think that keeps, running through my mind and also teaching me a lot that we can have, a whole Zambia as a country, but then a community A is different from community B.
Mm-hmm.
And so we need to focus more on that community when we want to focus on that community, which I think is a very, strong point that I think as African and even people who work in tech, we are kind of lacking. And that's why it's always, good to engage people from all disciplines to help you think about how to collect this data, how to even, approach the people and all that. And for me, I think I also have like one major concern to raise about working with people to collect data. Most of the time, I feel like some of the methods are more of extractive, more than, engaging the community to actually create the data that I think should be also looked into more, because at the end of the day, if you approach someone and then you tell them, okay, I want to build, this huge AI platform that's going to change your life, some of the people don't understand what you're talking about. And so it's always good to, engage with them in the terms that they understand so that they're able to give you the data that you need. Else, at the end of the day, they will give you something that is not more representative. Yeah. So I think these are some of the points that I wanted to touch on.
Great, thank you. And this brings us to Kutisha's 5 points of recommendation, the whole issue of equity, informed consent, inclusivity, and a lot of what I'm hearing, leadership, and I push to focus on not just national, but municipal and community up. Municipal leadership is critical in the complex that you describe, Kutisha, because those things get discussed at a national and a global level, and we miss the people who are really the implementers on the ground. And if they don't get it, communities don't get it. Those are the people, community engagers, and we'll be thinking of the African context. And then it brings us to the issue of infrastructure. We could have all the knowledge which Africa has and the research expertise, but the infrastructure, the satellite is failing, you can't connect. You can have all the AI models, but you can't get it. Dr. Mable can't get feed when she's at an outpost clinic, right?
Yes.
And that requires leadership. Abigail mentioned data storage, all of those things. The transformational leadership, Dr. Kutisha, has to include municipal and community level. Give me some responses and from what you heard from your two colleagues. And I give you 2 minutes to respond, and then I'd like to bring in the if there's still people in the audience to hear questions from them. Go ahead.
I completely agree with you that municipality needs to be included, but platforms such as IPSP, Way Forward, and Urban Health 360 help to bring the interdisciplinary experts as well as, excuse me, allergies.
Sure. Yes.
As well as the different sectors, multi-dimensional sectors together. And so we need to have this because a lot of times people don't think about how all of the sectors actually need to be talking to each other and seeing how it works. And then beyond that, you not only need to be working with the multilateral organizations and the civil society organizations, we need to allow the community's voices to be heard. And as Dr. Mable has mentioned, that they have a lot more knowledge than people give them credit for. They are actually, in many instances, the experts because they're on the front lines. And then when Abigail was speaking about the collection of data, we not only need to collect the numbers, but we also need to collect their voices because it makes them human and their experiences more human. And I know that Dr. Dimas is on the line.
Yeah.
She is actually owns a NGO in Nigeria, and they do a lot of community work in the urban areas as well as the rural areas. And she's committed to trying to work with different groups and organizations, and we need to be committed to supporting every group and organization because there's enough room for us all to be advocates, enough room for us all to grow, enough room for us all to support our global communities.
Mm-hmm.
And especially now during this time, we don't want to forget that we have to, yes, AI and technology is really good for us in some ways, but we have to think about the implications when people come in and are mining and taking up resources, which cause environmental and health issues. And if we don't keep that in mind as we work through that, then we're going to have I'll say larger issues that we may not be able to dig ourselves out of. So thank you.
And that's where the community and the municipalities come together, because the more the municipalities understand and engage, they'll push up to the national because this mining is happening in their localities and their voices are stronger. They may not be all immediately successful, but the level of awareness and the impact of the mining on their and their families, their children's health, there's more awareness and there's more voice. A collectivity. In sociology, we talk about collective efficacy, and that's something that we miss in communities and municipalities, because the more communities and municipalities have awareness and understanding and a relationship to, kind of Abigail saying, why are you collecting these data? Here's why we're collecting them. We're trying to amplify and highlight this issue. You are experiencing this, and we're trying to understand why, and we're trying to show you what might be the causes of this. If we approach it that way, we increase the collective efficacy of people in communities that they can say, yeah, we've noticed this. So that's what you call it. And it gives them greater voice and they can better articulate. And a collective group of them can force a municipal governor or municipal leader to say, I better pay attention because these people are coming. So when I go to the government level, I need to raise that. It's a multi-layered persistence that needs to happen. And we, as researcher and knowledge bearers, play a significant role in that. So before I bring, I think Dr. Demas, if Dr. Demas would like to join the stage, and Karthika, if you have any question you'd like to join the stage, please feel free to do that. I will ask our technical person, Bukanjo, to add you to the stage. In the meantime, as we see if they are connected or if they're interested in joining, I have a call to action for the three of you in the last 4 minutes that we have. This discussion, part of at my stage in my career and my level, why I bear these discussions. So what do we do about it? We've had a great talk. We've highlighted things that are particularly important. My call to action to you is that I'm going to circle back to the three of you. We need to write something, and we need to develop an approach that can be carried, not just here, but beyond. So that's my call to action to the three of you. I'm going to be coming back. I want to see your three of your names on something, building on the presentation today, building on Kutisha's 5 recommendation points. How do you, at these multiple levels, at least these 2 levels, begin with community and municipal? We'll worry about national and global later. Those are easy. How do we implement that? So welcome, Karthika. You're here. Karthika leads the ICH. Would you tell a little bit about your organization and what you heard today?
For sure. But before I get into the introductions, I'm just really thankful for the presentation that was done today, because firstly, the diversity of experience itself within the kind of like within Africa, the amount of diversity there was, it blows my mind. And coming from India, that actually just gives me a lot of hope when it comes to knowing that there are people across contexts where a common thread can potentially be drawn, and experience and learnings can actually be conceptualized. That being said, a little bit about me and Karthika. We work all together at the International Center of Humanity, and we at ICH, we're focusing on trying to, and we have talked about localization a lot, even within these throughout these series, and outside of it also, we often talk about localization, where we give communities the agency, the space to implement and do interventions in the manner that makes sense to them, because they're the closest to the problem and also the closest to the answer in many ways. At ICH, we try to do that by connecting individual actors from different places. We have people from different continents who are doing their own initiatives, their own projects, which have honestly come out of the challenges that their people and the community were facing. And we try to connect them with actors who can potentially support them materially, who could provide them guidance sometimes, or who can actually just provide more insights because they have done something similar in their own ecosystems. And Yonette did beat me a little when it came to the question, because I did have a similar line of thought, because this is wonderful work. And there is a lot of, it's not just insights, but there's also a lot of connections that you all have drawn through your research, which often a person sitting in the community might not really make, because you mentioned about liver diseases and you talked about how that was actually because of the environment, and nobody really draws that line until they see a larger control group and they see those patterns. So, and I'm not sure if there's an answer to this also, but as local actors, because they are the closest to this and they are also the people who suffer the most when it comes to these things, how do they organize themselves to? And because with what Yonette said, there could be a digital frame, there could be a framework that is employed, and there could be an institutional mechanism in place of those regions for sure. But is there something citizens or communities like can do to actually combat these things? Or would there be manifestations that maybe we can read about and can take a little bit of inspiration from?
Who wants to take that on? I think it speaks to the knowledge and awareness. This is one of the reasons I created Urban Health 360, because I realized that as scientists, and we go to wonderful places, we have these conversations, we write papers and books, and we talk about the communities over there and what they're experiencing. But there's no community voice. Do those communities, are we listening to those communities? How are we engaging them? There's this chasm. And on the goal for Urban Health 360 is to bridge that divide. It's a long-term goal. It's pedestrian. You have to keep walking towards it, and every day it's a challenge. But a lot of times that information coalesced in that way in that paper, showing the effects, linking the mining to the liver disease, and in this particular, or the kidney disease in this particular way, does not reach that community because it's written for a journal publication and an understanding. But the community, they have a connection. They say, well, wait a minute, this started happening when we started doing this thing. And we know in this particular area, because of this, that's what, we have these disease patterns. But nobody is, well, not nobody, but we often miss that direction of the discussion. So how do we work with you to bring you more knowledge, to show you that you're not wrong? Here's what the science is saying. Here's what the physician is seeing. Here's why that's happening. And maybe given that knowledge, how can we intervene at different points to arrest it and ultimately stop it? And in many instances, as Kutisha pointed out, it might mean that there's a political action that needs to happen. But we often tend to start with the political action and don't start the reverse. My thing is, let's do the reverse. Because when people are loud and their voices are raised, politicians do answer, because their politicians are their constituent. They're the constituents of the politicians. And so it's pedestrian, but it needs to be done. It needs to be a multidisciplinary effort. Oftentimes, we as disciplines, we're siloed. We're doing our thing, and we're not talking to each other. Urban Health 360 is trying to do that through this seminar. That's why we linked with IPSP. And beyond IPSP, we're going to continue doing this. This is why it matters. And this is why it's so important to engage you, Karthika, in India, Mable in Zambia, Abigail in Ghana, Kutisha in the United States, and linking across the world her work at UN and engaging. That's why me sitting here in Maryland, what you're talking about, yes, I'm in the United States in Maryland. I'm in a county, Prince George's County, where many of those things exist. And so recently I found myself involved in political action as a grassroots member. I didn't think as a scientist researcher I would be involved in that. Who gets fun? Why don't vote for that person because this is not what they're focused on? And how do we engage? That's what we have to do. It requires us to do that now at multiple levels. So that's not an answer to your question, Karthika, but it says that we have work to do, and the work is now, and what we're doing here is part of that work. So I'll broaden the call to action. I would engage the four of you further in that conversation. How do we, even if it's a commentary, we start with one commentary to be written and then develop, because baby steps, we creep before we can stand up and walk, and we have to be pedestrian and persistent. So unfortunately, 90 minutes is not even enough for this conversation. We need more time, and we're out of time. So I thank you for this discussion. The beauty of this, because there are time zone issues, we don't get a lot of people participating. However, we're seeing 300 and 400 plus people going back to the YouTube channel, and many people are reaching out. So share this recording broadly when it's up. It's on the YouTube channel, and let's keep this work that you all are doing. Your generation, it's so important. I'm just a cheerleader helping to facilitate. So thank you again. and we continue this discussion. Let's keep it ongoing. Okay. Thank you. All right. Be well. Take care. Bye.